Hi, I'm Dr. Marika Raff.
I'm Dr. Lee Caperton.
And we're here at Caperton Fertility Institute, and we're going to be going over the top 10 myths with infertility. Myth number 1, a woman can get pregnant anytime during her menstrual cycle.
That is not correct. So women have about a 5-day window in their cycle that is right around the time, more likely before the time of ovulation, that they can get pregnant, and then the whole rest of the month they cannot get pregnant having intercourse. Myth number 2 is that age doesn't matter on the female side until women are 40.
That is not true. So age can affect your fertility starting in your 30s. After the age of 30, your egg number and the egg quality can decline over time. It rapidly decreases after age 40.
Myth number 3 is that in vitro fertilization, or IVF, is only for women who cannot conceive naturally.
That is not true. So IVF can be necessary for multiple different reasons. Male factor infertility, individuals that may need genetic screening for some reason, lots of other reasons why IVF may be the only way for women to conceive. Myth number 4, stress causes infertility.
So in general, that's not true. There's a couple of little circumstances where you can have enough ask on the human body, like elite athletes or people who are very lean can stop having a menstrual cycle, and some people equate that to stress. But just the normal daily stressors of life do not appear to impact fertility in any profound measure. It is true, though, it's really hard to measure stress in humans, right? So setting up a good randomized study that says, what if we do this stress to someone, does it impact fertility, is a really hard thing to do. And so the data is not robust, but it appears that it really doesn't have much of an impact in fertility. Myth number 5 is that if you've had a child, that you won't have any trouble having a second one.
Yeah, that's certainly not true. We see a lot of women and couples come in with secondary infertility, meaning they had an easy time the first time around. So there's lots of options for helping you achieve that second pregnancy. It starts by coming here to Caperton Fertility for an evaluation. Myth 6, it's always the women's issue.
That is absolutely false. We have a tremendous number of patients who have male factor infertility. And what's interesting is oftentimes there's so much focus on the female side that the man just gets lost in the shuffle and never even has a semen analysis done. So at least 40 to 50% of men who present to a fertility practice will have some contributing factor that's making it harder for the couple to get pregnant.
Myth 7, birth control causes long-term infertility.
That is 100% false. But it is a very common myth, and it has been promulgated not just by physicians, but by parents and grandparents and moms and everybody else. When the birth control pill is discontinued, it's gone in a couple of days, and whatever is going on underlying that we're masking with the birth control will be the resumption of your cycle. So there's really good data, and we actually use birth control pill all the time to start an IVF cycle or to get people into the right spot in the cycle to make them ready for fertility treatment. So that's absolutely false.
Yep.
Okay, so myth number 8 is you just have to relax and you'll get pregnant. This is about your stress and how you're handling it.
Yeah, we definitely have a lot of patients that come in and they've gotten some solicited and unsolicited advice from their, family and friends about this. And, most of the time there is an underlying cause for infertility, and it really has nothing to do with, your stress, your, outlook on parenting. So if you come in and see us, we're going to help you to find that cause. Myth number 9, lifestyle choices don't impact fertility.
Yeah, so that's not accurate. There are a lot of things lifestyle-wise that can impact fertility. Most importantly, probably being overweight, which has become a big issue in the United States, of course, for all of us. Smoking is a real issue from a fertility potential, more so smoking cigarettes than smoking marijuana is. But chronic smoking and exposure to smoke because of all the free radicals and stuff can damage the eggs and damage the sperm and that kind of stuff. Having a normal, healthy, exercise regimen clearly improves fertility. And then there's some things like high temperatures that can impact fertility. Exposure to like heavy metals, like there's not a lot of this anymore in society, but lead paints, any kind of heavy metals, toxic chemicals, that kind of stuff can impact fertility. So there are some things in the environment and in your lifestyle that can affect and improve fertility or decrease fertility. Myth number 10 is that in vitro fertilization, or IVF, guarantees a pregnancy.
Well, although the technology associated with IVF has certainly improved and increases your chances of achieving a pregnancy, there are certain factors like age, health, and what your infertility factor is that can really change your outcomes. And we here at Caperton Fertility always like to give patients a sort of a realistic expectation of what they can achieve with IVF. All right, guys, so that was the top 10 myths of infertility. If you want clear answers, come visit us here at Caperton Fertility Institute.
That was pretty good. Okay, hold on.